Hey, Medicare Mike here, running through a quick overview of what Original Medicare is, what it covers, what it costs. Original Medicare is made up of two parts, Part A and Part B. Part A is going to be your hospital coverage. This is going to cover you if you are admitted to a hospital or if you have to go to a skilled nursing facility. Also covers home health care and hospice. So your costs, what are they? Most people do not pay anything for Part A. This is because you've already paid into the Medicare system. Technically, the rules are you or your spouse having paid into that for at least 40 quarters, which is 10 years. So you don't pay anything on a monthly basis, but it's not totally comprehensive coverage. So if you have to use the plan, there's actually some additional costs that you have to pay. First one is the hospital deductible. So you have to pay $1,408 in 2020 before Medicare is going to pay anything. And it's unique because it's a per occurrence deductible. So if you go into the hospital, come back out, have to go in 3 months later, you have to pay that all over again. If you're in the hospital longer, your costs add up. You see days 61 through 90, you're paying about $352 a day each day that you're in the hospital. If you're in there beyond 90 days, that doubles to $704 for the next 60 days. If you had to go to a skilled nursing facility after being an inpatient in the hospital, then you're not going to pay anything for the first 20 days. But after that, you're going to pay $176 each day for the next 80 days. Medicare Part B, this is the second part of Original Medicare. This is going to be your doctors and your medical coverage. Basically what it is, it's your outpatient coverage. So doctors, lab work, physical therapy, even chemotherapy falls under Medicare Part B. For people just starting Medicare in 2020, most people are going to pay $144.60 a month for this coverage. But then, if you have to use it, there are some additional costs similar to Part A. But this is a calendar year deductible, and it's much smaller, $198. After you reach that deductible, you'd have to pay 20%, and Medicare is going to pay 80%. The unique thing about your 20% is most health insurance has a cap where if you hit that 20%, then you're done, you don't pay anything more. Medicare doesn't have that. There's no cap, there's no limit to that 20%. So, what can you do? I'm going to show you a couple different options here after this, but you also need to know a couple things that are not covered by Original Medicare. Dental, dentures, routine vision care. The big one is long-term care, not covered by Original Medicare. And another thing on the right side is prescription drugs. It's not covered by Original Medicare because it's covered under the prescription drug program, which is Medicare Part D as in dog. As far as what you can do to help fill some of those gaps in Medicare, there's really just two main options. One of them is a Medicare Advantage plan with prescription drug coverage included. The other one is adding a Medicare supplement to your Original Medicare along with a standalone prescription drug plan. I've got a separate video that runs through the key points of those. So you take a look at that or just give me a call directly and I'll talk you through it and answer any specific questions that are unique to you. Again, Mike Lovell, phone number for me locally 608-571-4461, or you can reach me toll free 855-712-7316, or email Mike at askmedicaremike.com. Thanks.